Okay, let's say you don't have extra arm pads to put on the patient's legs. So we have the arm pads here. Let's just say you haven't purchased an extra pair. You do just as well without them. I'm going to show you how we wrap without. I would just take this large pad and put it down on top of the legs. And then she's got the pad underneath the bottom, okay? So if that's what she wants. A lot of women who have problems with crepey skin, texture problems, I would make sure that I cover all their legs up really well with that. So, the other ways you could wrap would be, let's just say they don't want their arms done, but maybe they want their knees done. So maybe this patient has perfect upper leg, maybe she wants her knees done. Or let's just say she's injured. You know, I wrap a lot of patients who are injured. She has a knee injuries or what have you. This is how I wrap her knees, and I do the other one exactly the same. Let's say the patient she doesn't want her butt done, because a lot of patients don't. I pull this thing out. She just wants her stomach done. I would have a pad underneath and a pad on top, okay? Very seldom do you find women who don't want their buttocks done, but then the men don't. If you're a man and you're coming in here and you just want your stomach done, this is the setup I would have. Just one underneath the back and one on top. So that's the setting. Most of your guys are good with that. Just make sure that you have the pants pulled down enough to where this pad will go over it. Get the belt off, because it could ruin your pads. And same thing, I would use if I had, let's say I have an ankle problem, maybe she's got ankle pain, or maybe she wants to loosen her calves, I would wrap her ankles just like this, or I would wrap her calves just like this. The other way you can wrap a patient, and this works out really well too, is maybe they don't want their buttocks done, but maybe they want their top of their legs done, and you don't have enough pads to cover all that. You could do this way even. Or if you do want the bottom of the legs done, you have that patient sit up, put it under and down. Now she's getting her butt done. She's getting the texture on the top of her legs done. She's getting her stomach done. You can always have her put her arms in her like this. There's just so many different ways here. You can even get a wrap, maybe take one of these wraps, put it underneath her and wrap her around with it. There's different ways. Okay, let's do the face mask. Say I got my patient wrapped up. With the face mask, you're going to have to unplug a plug if you have extra arm pads, but if you don't, then you'll have plenty of room. Make sure that you have some goggles of some sort. You can get them with the string around. These are just plain old blackout goggles. I make sure that I remove the pillow from the patient's head, because otherwise it will be very uncomfortable, and you don't want this to rock back and forth. So I place the goggles on the patient. I let her know it's coming over. It's coming over. And now we've got her stomach done. We've got her décolleté is done. All this area right in here is getting hit with this, and her whole face is getting hit. Now, if the patient doesn't have a bra on and you don't want to lose in the breast area, you're going to want to get a sheet of some sort or something and cover the breast up, because this will go down into the breast area. All right.